Hello everyone, hello Mr. Morla. In this occasion, we will continue with the exercises of the units. Let's begin with the unit 24, infections. Find the two parts of sentence. Look at A, B, and C opposite to help you. 1988 saw UK launch of live attendant. J. Chickenpox, varicella, is a common infection. B. Rabies has a incubation. A. The patient remained free-flowing. H. He was admitted with 4-day history of influenza-type symptoms of fever, which B. Quite a proportion of patients who recover from hepatitis B. C. The central part of Africa is the midst of the epidemic F. Measles, rubella is must be. Lyme disease is caused by transmission. G. QO stands for I. We got the answers down. Complete the case report of the patient in A opposite. Look at A, B, and C opposite to help. Case 45. On examination, he looked unwell. His pulse rate of 100 minutes. He, he had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 or 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentence. Look at A, B, and C opposite to help you. An infection which can be treated successfully with antibiotics is curable. Another word for the epidemic is an outbreak. Bacteria and virus are examples of microorganisms. Someone whose temperature is normal in a fever. The common infection with Epstein-Barr virus is known as glandular fever. Now we continue with the unit number 25, mental illness. We'll be completing exercises. Complete the table with words from A, C, D, and E opposite. No, adjective. No, affect, adjective, affective. Auxiliary, anxious. Behaviors, behavioral. Demetrial, demented. Perturbance, disturbance. Suicidal. Make word combination using a word from each bus. Two words can be used twice. Look at A, look at B, C, and near bus to help you. Behavioral, syndrome, eating, disorder, major, depression, mental, retardation, personality. Personality is a disorder. Physiognomy is retardation. Sleep is retardation. Substance is abuse. Complete the sentence, look at the A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of demeria associated with age is called senile demeria. A disorder which is not associated with pathological change is functional. An idea which forces a patient to repair unnecessary action is a compulsion. Which symptoms of depression was this patient suffering from? Look at the opposite to help. Case 41. A 56 years old woman present to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denying any suicidal tendencies. She was tight and was pacing urine more often. She was eating normally and her weight was steady. Now we continue with the unit number 26, the nervous system. Exercise of the unit 26, nervous system. System 1. Complete the table with words A, B, and C opposite. Adjective. No. Blank. Blindness. Conscious. Consciousness. Deaf. Deafness. Dizzy. Dizziness. Numb. Numbness. Lightheaded. Lightheadedness. Untethered. Untetheredness. Make word combination using word from each box. Look at A and B and C opposite to help you. Double. Vision. Epileptic. Fit. Credible. Symptom. Sick bug. Attack. Urinary. Incontinence. Visual. Acuity. A doctor is trying to determine the cause of loss of consciousness in a 52 years old man. Complete the doctor's question. Look at C opposite and at the table in 26.1 about to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before the pass wow out? Were you worried or under any stress at the time? Did you feel dizzy or like heated before the attack? Did you lose control in your bladder? Did your wife notice any involuntary movements while you were unconscious? Unit number 27, the nervous system 22. Nervous system 2. Let me see. Nervous system 2. Well, we will read here. Complete the table with word for name and be a positive. Look at the unit in your book because I don't pass the image to the computer. Well, complete the table with words from name and be a positive. Noun adjective. Absence, absent. Diminution, diminuted. Flaccidity, flaccid. Spasticity, spastic. Wasting, wasted. A doctor is giving instructions to the patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. I'd like you to relax. I'm just going to move your arm up and down, muscle down. Can I see your hands? Muscle back and possibly involuntary movements. Now I'm going to straighten your arm out. Try to stop me. Power. Can you touch my finger with yours and then touch your nose? Good. Now now do it again with your eyes closed. Coordination. Complete the sentence. Look at A, B, and C opposite at the table in 27.1 about to help you. A flaccid hand strips limply to form a right angle with the rights. Freaks reflex are reflexes that are stronger than normal. The muscle wasting means the muscle is reduced in bulk. A tick is a form of involuntary movement. A kick is often used to test and bar basket response. His coordination was poor. He could not perform rapid alternate, alternative movements. A tendon flex hammer is used to test reflex. When something is stimulated, it is less than normal. A, a patient is brought to A and E in coma. When her name is spoken, she opens her eyes, but she does not answer questions or about instructions. What is her GCS score? GCS 5, eyes opening. 2, speech. 3, verbal response. Noun 1, moral response. Noun 1. Okay, that's it. We continue with the unit number right. Is oncology. Computer table is word for name, B and C opposite, and related forms. Verb, noun, adjective. Curative. Exercise, exercise, excision. Grow, growing. Inside, invasion, invasive. Obstruction. Obstacle. Palliate, palliation. Palliation. Palliative. Palpit, palpitation. Palpable. Spreading. Swell, swelling. The notes below are about the patient described in the opposite. Use turn to put the sentence one night in correct order To make the next paragraph of the case report, use appendix. Uh, it on page 20 if you need help with the abbreviations. Uh, Complete the sentence. Look at A, B, and C are possible to help you. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. The malignant neoplasm is called cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of primary. If a cure is not possible, palliative treatment should be given. The palpable liver shows metastasis. Okay, we continue with the next unit, unit number 29, and is pregnancy, pregnancy and childbirth. Childbirth. Number 29. Complete the sentence. Look at A, B, and C approach to help you. A baby that is born a week before the ADD is premature. A termination pregnancies may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. The fetal distress in the first stage of labor section is indication of cesarean section. It was breech presentation and delivery was by forceps. Uh, mis- miscarriage is another term for spontaneous abortion, abortion. The umbilical was wound tightly around the baby's neck and it was unfortunately cord. Complete the table which was a positive. Bear, no. Abortion, delivery, induce, induction, miscarriage, presentation, terminate, termination. Dr. Bennett ECHO is presenting a patient at the weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of birth from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had pregnancies when she was 18, which was terminated, and another one a year later, which spontaneously aborted. Since then, she has had 3 pregnancies. In the baby was delivered normally at 40 weeks. In the second, she had a induction of labor at 39 weeks because of fetal distress. The third baby present as a fish and was delivered by cesarean section. Okay, we continue with the unit number 30. Is the Respiratory system. Respiratory system. Let's begin. Make words combination using a word from each box. Look at A and be a person to help you. Blood, stain, breath, sounds, pleural, rub, productive, cough, vocal, vocal is resonance. Rewrite the questions using words that are better known to patients. Look at a person to help you. Is your code produced? Do you code up any reality? Is it the lost code? What color is the sputum? What colors is the flame? Is it ever purulent? Is it over yellow? Have you ever had a hemolysis? Have you noticed any blood in it? Do you suffer from tetanus? Any problem with your breathing? Are the following stems true or false? Give reason for your answer using your medical knowledge and A and B opposite to help you. A productive cough is often described as loss. A comment. A patient who has a lost cough produces phlegm. Cackles are heard when the airways are narrowed. A patient who has a non-productive cough produces sputum. Wheezes are typical of pleurisy. A better rub is a sign of asthma. Now we continue with the unit number 31, the skin. The skin one. Okay. Uh, Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at a positive help. Common word, medical term, type of force, bruise, contusion, blunt, cut, incisive, sharp, graze, abrasion, blunt, scratch, abrasion, blunt, stab wound, uh, penetrating, sharp, tear, laceration, blunt, 31.2. Choose the correct form. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left eyebrow and on the left side of the neck a contusion to the left side of the lower lip and tears to the left chest. Write a description of the injuries shown in the illustration. Look at A be opposite and not 32.2 about to help you. There is a laceration or tear on the left shoulder. We can see inside one a cut approximately in the length above the left nipple. Complete the sentence. Look at A, B, and C opposite to help you. Frequent changes of position are necessary in the immobile patient to prevent the development of pressure shock. He had stab, several stab wounds in the abdomen from the knife. He was knocked unconscious by a heavy punch to the head. The wounds were only superficial and required no treatment. Okay, we continue with the unit number 32, 33. That is the skin, uh, that is the urinary system. The urinary system. Okay, let's begin. Look at the conversation in A opposite and complete the notes about Mr. Jones' use medical terms where possible. Frequency and noturia for 1 year, dysuria or hesitancy, stream flow at the little water, no incontinence apart from occasional dribbling. Okay, 33.2. Match the patient's descriptions of their symptoms 1 to 7, from 1 to 7, with the medical terms A to H. Look at A opposite to help you. 1. I have to pee every half hour or so. B. I get a scalding pain when I pass water. A. I have to get up several times to pass water at night. B. I have to rush to go to the toilet. F. I have trouble getting started. D. I can't hold my water. G. I pass some blood in my urine. C. Write the doctor's question for each two symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. The answer is behind. Okay? Frequency, how often is that? How often do you pass urine? Uh, dysuria. Do you get any burning or pain uh, which you pass water when you pass water? Noturia. Do you have to get up at night? Existence. Do you have any trouble getting started? Hematuria. Have you ever passed blood in the urinary organs? Do you have to rush sorry to get toilet? Describe define uh, describe the findings of laboratory report in words. Look at A, B, look at B a positive to help you. Blood, protein, and cast. There was a trace of blood, gross protein, and no cast. That's it. Okay, now we continue with the unit number 34. The basic investigation. Basic investigation. The last unit. Point 34.1. The doctor is talking to a patient during ophthalmoscopy. Match the underlying expression she used from 1 to 4. The expressions with similar meanings from A opposite from A to D. Right, Mr. Call, because you have been having this headache. I'm going to have to look at your eyes, particularly the back of your eyes, the retina. I'm going to put a couple of drops in your eyes, which which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear off after about an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now, I would like you to look straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at the clock. The examination is done with diamylite. 3. A topical mydriatic solution. 1. Two-way dilation. 2. Fix on a target. 4. Complete instructions. Look at be a positive to help you. Move wrap the arm around the patient's upper arm. Place in the ground diaphragm over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Close the valve on the palm. Palm up the pressure to at least uh, 105, 150. Then measure. Open the valve a little and slowly to feel the cough while listening and watching the pressure gauge. The first sound you hear is the flow of fluid through the brachial artery. The valve on the top at the point is systolic blood pressure. Continue listening while you slowly deflate the cuff. The diastolic blood pressure is measured when the sound completely disappears. Complete the text. Look at see a person to help you. Phlebotomists are specially trained in taking blood. They are skilled venipuncture, puncturing the vein to take a blood sample. The right hand and foot can be used, but more often a vein in the inner part of the elbow is used. If it, if it is difficult to, to locate and so suitable vein, uh, the patient may be asked to make a first or an torn tourniquet may be applied on the upper arm to make the pain more apparent. Afterwards, greasing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It is important that the sperm tubes are level correct before they are sent to the hematology laboratory, where a full blood count or other investigation will be carried out. That's it. Were these were the units. Thank you so much.